As we get older, we all get more fragile. Our bones become weaker, our balance decreases, and the risk of falling increases. In every third home with occupants over 65 years of age, somebody will fall at least once in any year. And for residents over 80 years, this increases to every other home. One of the most common and serious consequences of a fall is a hip fracture. 90% of all hip fractures are caused by a fall. A hip fracture is a break in the thigh bone around the hip joint. It is a serious injury that almost always requires surgical repair or replacement. Unfortunately, hip fracture surgery is not a miracle cure. Both replacement and repair are followed inevitably by months of physical therapy, which for many can be very traumatic, and complication might occur. While 78% of hip fracture patients come from their own home, only 46% are discharged back to their own home. 10% never leave hospital care. 50% will never regain previous independence. In the worst case, it might be life-threatening. Fall accidents can happen day and night, and in all places. It is impossible to predict when and where you will fall, and it's likely it will be where you don't think you are at risk. Most falls happen in familiar places, such as the bedroom, kitchen, and on the stairs, places which are impossible to avoid. Most people will fall during their lifetime, but some are at higher risk of fracturing a hip than others. Low bone density is found as a primary factor in around half of all hip fractures, but other factors also influence the risk of fracturing a hip. Among these is age. As you age, your bone density and muscle mass decrease. Old age may also bring vision and balance problems, as well as a slower reaction time, which further add to the risk of falling. Gender. Around 8 out of 10 hip fracture patients are women. After the menopause, changes in the female body cause a reduction in bone strength and density. However, men can also have an increased risk of fracture due to lowered bone density. The reasons for this include age, lack of exercise, malnourishment, and being underweight. Although osteoporosis accounts for the majority of hip fractures, chronic medical conditions are an important risk factor. People with dementia, low blood pressure or incontinence problems have an increased risk of falling. The intake of medication also has an impact. Cortisone medications can weaken your bones if you take them for a long time, and certain drugs or the combination of medications can make you dizzy and more prone to falling. Have you fractured before? You have an increased risk of fracturing again. 20% of all hip fracture patients will incur a new hip fracture within 5 years. While it is best not to fall, it is also prudent to recognize that for some elderly, it is not a question of whether you may fall, but when you will fall again. And while you cannot control where or when a fall occurs, you can address the consequences of a fall. The fear of falling and lack of confidence often have a negative effect on your mobility and might increase the risk of falling. To protect your hips from injuries, we recommend using hip protectors. Hip protectors should be seen as a product that contributes to your own safety on the same level as seatbelt, life jackets, or motorcycle helmet. It reduces the risk of serious injury, saves money, and can also improve your quality of life by restoring confidence and allowing you to remain active, social, and reduce the fear of falling. Hip protectors will not stop you falling, but they can effectively and inexpensively prevent hip fractures. The Safehip hip protector was the first hip protector in the world and is a pioneer in the field. It has been clinically tested on more than 7,000 users. A Safehip hip protector consists of a pair of impact shields fitted inside a pair of briefs or a belt which ensures that the shields are always placed correctly. The Safehip hip protector impact shield is designed as a horseshoe. It absorbs and disperses the energy transmitted by a fall away from the hip. This means that the energy from the fall is absorbed by the soft tissue and the muscles around the thigh bone, thereby reducing the risk of a hip fracture. Safehip comes in 3 different models: Classic, Air X, and Active. Safehip Classic and Air X are mainly used in hospitals, nursing homes, or by elderly living at home. They are worn underneath your normal clothing. Classic has a PE foam shield and is available in 2 models, unisex and open. Air X has a soft spacer fabric shield, which makes the shield breathable and cooler to wear. Air X is washable at the high temperatures required in nursing homes and hospitals to prevent infection. It comes in 4 models, unisex, female, male, open. Safehip Active is mainly designed for use during rehabilitation or by people at home who only need protection in certain situations. The active belt is worn over normal clothing. Safehip is proven to reduce hip fractures by 2/3. Safehip has been tested in clinical trials around the world on 7,000 users. Safehip is the only hip protector in the world using the patented Shield technology. Safehip is an important safety product to ensure an active and independent life. Safehip hip protectors are available from distributors and at appliance stores and pharmacies.